lot of members are not aware that the Massachusetts Rhode Island Poison Control Center is housed out of Boston Children's Hospital and serves people across the lifespan. Because Massachusetts is not the first state to legalize recreational marijuana, we can learn from some of the legislation of other states. One such state is Colorado, where they have seen a dramatic increase in the amount of accidental ingestions among young children, with calls to the Poison Control Center in Colorado going up 5 times, and Colorado Children's Hospital seeing a doubling in the number of unintentional pediatric exposures. In addition to being a life-saving resource for people across the lifespan, the Massachusetts Poison Control Center provides data tracking and monitoring function that will be important in coming years to better understand the impact of legalization of marijuana. Furthermore, the Poison Control Center provides invaluable medical expertise and toxicologic consultation to hospitals across Massachusetts that do not have a dedicated toxicologist on their staff. 24 hours a day, 7 days a week, hospitalists that don't have a toxicologist on staff can speak to a fellowship-trained and board-certified medical toxicologist to assist with the management of critically poisoned patients. As high-potency edibles become more pervasive in the community, this role is going to grow in importance. Marijuana can cause many, many different psychologic and cardiovascular effects, including tachycardia, orthostatic hypotension, in addition to more serious effects like cardiomyopathy and ventricular dysrhythmias. Additionally, more serious effects like heart attacks have also been reported. We recently had a 16-year-old patient who came to our emergency department with the chief complaint of chest pain after smoking marijuana. His EKG and lab work were indicating that he had a heart attack. He was taken to the cardiac catheterization suite where we had biopsies done that did prove this fact. Now, this patient, through work with the Massachusetts Poison Center as well as the toxicology service, we assisted the cardiologist in diagnostic testing that was evaluating for other drugs of abuse, things like synthetic cannabinoids that might have explained this patient's presentation. Additionally, we worked through collaboration with the Massachusetts State Public Health Laboratory to test the marijuana. Today, the patient continues to suffer from a dilated cardiac myopathy, a direct result of the heart attack he suffered. His gross hospital charges were over $130,000. And while this is a rarefied outcome, marijuana-induced heart attacks are not without precedence and have been reported before. 2 bills that I think are important to mention: an act relative to marijuana product packaging and labeling will go a long way to reduce unintentional pediatric exposures, and we support that legislation wholeheartedly. And then similarly, an act relative to marijuana potency is equally important, as this will allow for education and will allow research of the effects of high potency THC on pediatric patients. Thank you.
Thank you for your testimony.
Quick question. I appreciate you coming out. Appreciate what you do. We've seen a lot of data coming on emails and whatnot. Do you have some of the data on alcohol? How many people come to emergency rooms on alcohol? 15-year-olds, 13-year-olds getting alcohol. I think we're trying to do. No one who was for this bill, but before I think it was trying to increase adolescent use. That's not the intent that was here. But we're trying to find the middle ground and find how we treat alcohol. And it's important for us to know what kind of alcohol symptoms are coming to our hospital. So if you can provide any of that for us, that'd be great. I can follow up with you with an email, but I think that information would be good to have.
Okay. So I think some of the issues is when a unintentional exposure happens in a pediatric patient, how are they being treated in the hospital, and what is your diagnostic evaluation? Many times when a 4-year-old comes in and you don't know what they were exposed to, these patients are getting full neurologic as well as infectious disease workup. So this means getting blood work. This means getting lumbar puncture to access cerebral spinal fluid. It means getting MRIs, which requires many times in a 4-year-old getting sedation so that they don't move while they're in an MR suite. These are things that we do not typically see in intoxicated adolescent, because they're able to speak to the fact, I went out and I did X, Y, or Z. Similarly, in terms of diagnostic testing, we are not able to get a real-time THC level back on a patient the same way we are to get an ethanol concentration. So I think the diagnostic evaluation of these patients is very, very different.